Okay, class, we are on the second part of your Innate Immunity 1 case series lecture. And the coverage of this video session is your inflammation together with your APR. So I will introduce a brief discussion on your inflammation, and then, as I mentioned earlier, and to your previous video lecture, that the end product of your inflammation is activation of your APRs. And then we will try to cover, like, of course, you're asking questions kung saan ba galing yung APRs, which organ produced this one, or which cell produced this one. We'll try to cover that one. And, or, like, for example, you've been maybe asking if, like, what's the function of your APRs, not only with the immune system, but also as for clinicians, example, medical laboratory scientists, or if you'll pursue medicine and or infectious disease, because your inflammation together with your APRs are good markers class. So please, hopefully that you can get something with this video lecture, not only for the preparation of your quiz and for exam, but also for the preparation of your future career. Okay, so again, you can follow my discussion using my using your reference book. I am using Stevens and third gen class. Okay, so let's start. So if you have some questions, please don't hesitate to contact your professors so we can clear up the gray areas of your immunology and serology. Okay, my slide is not moving, class. Okay, so let's start with the definition of your inflammation. Okay, so you know this one, the term inflammation, you know this one already. Okay, so by definition, it is the overall reaction of the body to injury or evasion by certain infection agents. So for example, gibugbog ka, di ba? Even without the organism, you can still react with that one because you have your DAMs or damage associated patterns. So, two molecular or cellular naman siya class. With the bacteria, of course, one best example is invasion of your bacteria. So, pag may bacteria ka class, your immune system is trying to control that one in one location. Kaya that's the reason why, for example, na tusok ka og something class here in your hand on this part. And then later you will observe that there will be swelling. Swelling, it means that, they are trying to control, localize the area of inflammation. So the bacteria will not go beyond this area. Okay? Kaya nagkakaroon tayo ng class. Overall reaction of the body to injury or invasion of a certain infection agents. Okay, so take note, class, that the primary objective of your inflammation is to localize, okay, and eradicate the irritants. Okay, irritants, it means your infectious agents, okay, and repair. Okay, class, hindi pwedeng ang inflammation hanggang localization lang siya in eradication of your irritants. Okay, it should have a complete process from localization, from eradication, and then repair. Okay, take note with that one. That's the primary objective of your inflammation class. So we have 3 stages of your inflammation. So you have your vascular response, you have your cellular response, then you have your resolution and repair. Okay, these stages will cover the primary objective of your correct inflammation. Diba, as I mentioned earlier, dapat daw sa primary objective ng inflammation mo, you have your localization, eradication of your irritants. This could be a part of your vascular response and cellular response. The localization is more on the vascular response by vasoconstriction, vasodilation, and then you have your eradication of your irritants via your cellular response through phagocytosis, and then the repair of the surrounding tissue by your resolution and repair. Okay, so basically, this is the 3 stages that we need, okay, to understand by heart. Okay, let's start with your, of course, the first stage, your vascular response. Okay, in your vascular response, the first response we have is your vasodilation. So vasodilation, it means that, for example, from this one, ito muna ang class, this one is the, the normal, okay, space nung vessels mo, and then if you have your vasodilation, it will enlarge. What is the main purpose of vasodilation? It will allow the immune cells to go inside, okay, easily. Kasi pag masyadong maliit yung class butas, they cannot easily go inside, and therefore the vascular response will allow the immune cells to go and also increase the blood flow to the injured site. Okay, this is the reason why, class, that during the first stage of your inflammation, you have your rubor or hyperemia, class. Okay, rubor or redness naman siya. Okay, namumula ka because of your vasodilation. Okay, and then after the vasodilation, of course, it will follow your increase as your capillary permeability. Okay, yun yung class. Okay, with the leakage naman, with the permeability. So for example, this is your uh, uh, for example, endothelial cells, and then if kung merong inflammation, class, it will increase the permeability, it will try to open, and then there will be a plasma leakage. If kung may plasma leakage, class, ayun na, meron ka ng swelling, that's your tumor, okay? Your tumor is your swelling, and then you have your dolor, that's your pain, okay? Kasi pag meron kang swelling, class, it also have your dolor. Okay, dolor is a Latin word for, I don't know, class, sorry, I forgot if it's a Latin word or the Greek word, pero dolor, it means in our English term, that's pain. Okay, and then after that one, after your vascular response, class, and then we allow to recruit your cellular response. Okay, for your cellular response, class, I would like to explain this one carefully. Kasi for example, you have your macrophage here, class. Okay, here, allow me to have my, sorry, class, allow me to have my, sorry, move siya. Allow me to have my laser. Okay. So for example, you have your activated macrophage. Your activated macrophage will increase your interleukin-1 and your TNF alpha together with your cytokines. Okay. So these are the humoral part of your innate. Okay, you have your cytokines together with your interleukin-1 and then you have TNF alpha. Okay, sir, what is the function of interleukin-1 and TNF alpha? Why do we need to study that one? Why, class? Because if the activated macrophages detect the organism, they will try to signal the endothelial cells. Okay, they will try to signal the endothelial cells na there's a danger. And then, how does your activated macrophage or macrophage talks to your endothelial cells? How? Okay, they don't have words, class. Diba? Correct. Okay, the communication molecules, we call that one cytokines. And example of your cytokines is your interleukin-6 and your TNF alpha. So sir, ano ang function ni interleukin-1 at saka ni TNF alpha? So they will try to talk to your endothelial cells to express or overexpress your selectin. Okay, this one is your selectin, class, the green one. Okay, this one is your selectins. Normally, may mga selectins naman talaga sa endothelial cells, pero kukonti lang siya, class. Okay, pag meron tayong oversecretion, class, pag meron tayong expression of your selectins, it means that there's something wrong inside, okay, on the vascular level. So therefore, the neutrophil on the endothelial cells, okay, kasi the distribution of your neutrophil on the body, 50% is on the blood, 50% of the endothelial cells. Di ba? Ang tatalino talaga ng mga class, ng mga neutrophils. Why? Because they try to divide themselves. Okay, 50% you will try to circulate on the circulation ng blood. 50% will stay on the endothelial linings. Kasi alam namin, with the neutrophils, so parang neutrophil lang talaga ako, class. Kaya I know them. So with the neutrophils, they know that there is a chance that for example, pathogens can be introduced. Then, if kung merong chance, class, high chance that the pathogens will be introduced to the vascular level, then dapat meron mga class, immediate na mga responders, and that's your neutrophil. Tapos, si neutrophil naman, class, ang galing. Why? Because your neutrophil contains also your selectin ligands. So pag sinabi nating ligands class, that is receptor. So ibig sabihin class, your selectin ligands will bind to your selectins here. So pag nagbind na yan sa class here, this one, we call this one rolling. Okay? After pag nagbind na si neutrophil class with your selectin and your selectin ligands, it will overexpress your integrins. Diba? But your integrins are not normally present unless you have your selectin ligand selectin binding. Pag nag-bind na sila class, then you have your overexpression of your integrins. Then sir, what's the function of your integrins? Then the function of your integrins class is to bind on your integrin receptor or your ICAM1. Si ICAM1 kasi class, siya yung andun sa gate, okay, in between the endothelial cells. So siya yung mag-aalaw sa neutrophil to have to go inside. Okay, to go inside here. Yan, so papasok na siya. Okay? And then your neutrophil will try to kill your organism. Okay? Through phagocytosis. Although your phagocytosis will be discussed on your innate immunity part 2 class. Okay? Series lecture part 2. Okay? So here, I just wanted to like show this part class. This one. You have your interleukin 1 and TNF alpha with here. And also this interleukin 1 and your TNF alpha will actually go to your liver and then produce your acute phase reactants. Okay, so example of your cellular response class is your neutrophil, as I mentioned earlier. Okay, so it acts to your acute inflammation. We also have, aside from your neutrophil, we have your monocytes in your macrophages. Okay, your monocyte and your macrophages are more on the chronic inflammation. Take note also, class, that your monocyte, class, your neutrophil is not an APC. APC is antigen-presenting cells. So, anong ibig sabihin ng antigen-presenting cell? Diba? If kung sa Bisaya pa, class, antigen-presenting cells, sila yung mga, hindi pala yung Bisaya class. So, sila yung mga cells that can or capable of presenting the antigen to your T cells and your B cells, which is part of your adaptive. Okay, so one best example of your APC class is your macrophage. Okay, so they try to engulf, and then pag nag-engulf na sila class, they will try to present that one to your B cells and your T cells. Okay, so pagdating natin sa adaptive class, you will appreciate the beauty of your APCs, which is part in between your innate and in between your innate class and your adaptive. Okay? And then your monocyte and your macrophages are the major producers and secretors of your monokines, which is your interleukin 1. In interleukin 1 class is a pyrogenic factor. This is the reason why during the inflammation you usually have your fever, because it's a pyrogenic. Ibig sabihin ng pyrogenic, induce fever. Okay, they will actually go to your hypothalamus and then class, increase the production of your PGE, your prostaglandin, and then your prostaglandin will increase the body temperature. So I don't know if you discuss this one in your human anatomy, especially sa medical laboratory science. But for example, I took my nursing before class. We usually discuss all the pathophysiology, like pathophysiology of fever. So that's the reason why I am somewhat familiar with this one. Okay, so as medical laboratory scientists in the future, or medical practitioner or physician, at least we know that, your interleukin 1 is a pyrogenic factor, and this is the reason why nagkakaroon tayo ng fever. Okay? And then, of course, your interleukin 1 will stimulate your APRs, or acute phase reactants. These are the proteins that will increase if you have inflammation. And also stimulate your T cells, okay, to produce your interleukin 2, which induces your T cell proliferation. Okay, I know that your T cells is more on adaptive, so we will leave that one on the adaptive topic. But on this slide, I wanted to emphasize the function of your interleukin 1, because your interleukin 1 is very crucial in the production of your APRs. Okay, so this is the reason why in your inflammation, the production of your interleukin-1 or cytokines will lead to the production of your acute phase reactants. Okay? Ano ba? So now we'll try to cover your acute phase reactants, guys. So your acute phase reactants are biomarkers of inflammation. In other parameters class, we have ESR, diba? So your ESR, if you're not familiar with this one, you will perform this one in your hematology 2 or hematology 1. So if you're a medical technologist, you're gonna perform this one. If you're a physician in the future, you're gonna request this one. The main reason why we perform or we request ESR class for the patient is to determine if kung meron ba siyang active inflammation or chronic inflammation. Because although your ESR is not specific, but at least can tell if kung meron ba siyang active inflammation or not. Okay? And then aside from your biomarkers of inflammation, ESR, we also have correct class. You have your immune cells. For your immune cells, pag elevated yung lymphocyte, it means na merong viral infection, bacteria pag neutrophil, parasite pag eosinophil, chronic inflammation pag monocytes like Mycobacterium tuberculosis, and etc. Okay, and also we have here your serum protein electrophoresis. Okay, for your serum protein electrophoresis kasi SPE, it will provide different protein biomarkers. Diba? Yung tinuturo ko sa class, students, even like before, meron yan sa kamay. Ito, ganyan sa class. Okay, this is the pattern of your SPE. So you have your here, this one is your albumin class, okay, the highest peak. Then you have your alpha 1, and then you have your alpha 1, alpha 2, then you have beta region, and then you have your gamma. And then, memorize mo na siya kagad kung sino yung nasa albumin sa albumin, sino yung nasa gamma, you have your antibodies, you have your CRP. Then, if you have your beta, you have your transferrin, you have your alpha-2, you have your alpha-2 macroglobulin, you have your heptoglobin, and then your alpha-1 antitrypsin. Di ba? Madali lang siya i-memorize, class. Okay? So, ito yung pattern natin. Okay? So you have your albumin, you have your alpha-1, alpha-2, beta, and then you have your gamma. So for example, you have an abnormal serum protein class, okay, of your SPE. And then pag nag-increase yung gamma mo class, ganito siya, ganito yung itsura, decrease yung albumin, and then normal or decrease yung the rest of the bonds, then you have increase gamma region, then alam natin na may dalawang components na meron si gamma. You have your antibodies, and then you have your CRP. Okay, your CRP is more on the acute, it's more on the innate part. Your antibodies is more on the adaptive part. Yan, diba? So, alam mo na kaagad na, bakit nag-increase yung gamma region ko? Okay, antibodies. So, ano kaya na antibodies? Okay, then we will try to discuss that one when we will reach your antigen and antibodies, like what are the different types of your antibodies and their functions. Okay. And then, so elevated acute phase reactants, for example, this one as mentioned, you have your alpha-1 antitrypsin, you have your heptoglobin, etc. Those are your acute phase reactants. So we have two types of your acute phase reactants class, okay? So you have your positive acute phase reactants class, okay? Positive acute phase, ibig sabihin, these are the acute phase reactants or APRs that will increase during inflammation. Okay, example, you have your C-reactive protein, CRP, you have your MVP or mannose binding protein, and then you have your serum amyloid A. Okay, your serum amyloid A. We also have your negative acute phase reactants. So, sir, anong ibig sabihin ng negative acute phase reactants? These are APRs that will decrease. Take note, class. That will decrease during inflammation. Best example is your albumin, transferrin, and antithrombin. Okay? With antithrombin naman class at saka transferrin, these are used up during inflammation kasi. Okay? Kaya nagkakaroon tayo ng decreased number of these two. And also with your albumin, di ba? If we can observe on the abnormal SPE, this is the best example. Okay? If you can observe here, the albumin is decreased, then the gamma is increase. Okay, your CRP belongs to the gamma region class, kaya nagkakaroon tayo ng positive acute phase reactants. Okay, it means increase during inflammation. Then you have your albumin, then baba. Kaya pala, sir, here in this SPE, mababa yung albumin. Di ba? Kita nyo yung band? Mababa yung albumin band here. Okay? Compare with the gamma band. Okay? Masyadong makapal. Because we know that your albumin is a negative acute phase reactants. Okay? Yun, so take note of that one, class. Okay? So let's move to your characteristic of your acute phase reactants. They are group of glycoproteins associated with acute phase response. Okay, so these are glycoproteins produced by a certain organ. I'll show you later. Okay, in response to the acute reaction of your inflammation. Okay, they rise at different rates and in varying levels in response to injury. I like the presentation of Steven's class with a table, and also you can refer with Turgeon kasi meron siyang table din class with the acute phase reactants, tapos with the time kung gaano siya kabilis mag-respond, and also with the concentration. Okay? So here, if you can observe, as we discussed earlier with the inflammation, then your inflammation, they will release your interleukin-1, interleukin-6, and your TNF. Okay, your tissue necrotic factor. Okay, and then it will go to what organ class? Correct. Diba? You have your liver. Kasi alam natin, with all the parts of our body and organs, your liver is the one who manufacture proteins. Okay, so with that one class, except your antibodies, because your antibodies is not produced by your liver class, it's produced by your plasma cells. Take note with that one. Okay, so that's the reason why your liver is very important class. Okay, and then you have your liver. Okay, so your liver, due to the production of your interleukin-1, interleukin-6, and TNF, it will be activated and produce in different APRs. Okay? So they are initiated and sustained with your pro-inflammatory cytokines. So therefore, sir, so ibig ba sabihin nito, sir, pag if the inflammation, kasi alam natin, sir, that the stages of your inflammation, the last stage is the repair. So it means that if the inflammation will stop, then the production of your interleukin-1 and interleukin-6 and TNF-alpha will also stop. Then therefore, your liver will stop producing your APRs. That's the reason why, class, it is a biomarker of your inflammation. Okay? Kasi if kung nag-stop na yung inflammation, class, your liver will stop also releasing and secreting or making your acute phase reactants. So for the synthesis naman, class, you know this one already, that in the liver, that the primary cells are responsible for the production is hepatocytes. So within 12 to 24 hours in response to tissue injury, and then they are elevated 2 to 5 folds in certain diseases. Okay? So please refer to your book with a table kung ano yung mga specific diseases and ano yung mga APRs that increased. Okay? So, with the synchronous class, we will try to discuss and cover that one. Okay? And then, again, as I mentioned earlier, that the stimulation is due to the production of your cytokines, specifically your interleukin-1. Kanina, yung pinakita ko lang class is interleukin-1. Ngayon, specific na siya. You have your interleukin-1 beta. We also have your interleukin-6 and your tumor. Sorry, class, I mentioned earlier with the tissue, it should be tumor necrosis factor alpha. Okay, and also this is very important class to those medical technologists who will work as a medical technologist in the future and then collect blood sample for acute phase reactants. Please take note that we need to ask the patient. Okay, we need to ask the patient if, like, for example, outpatient class ha. Kasi very impossible naman kung inpatient, then you will ask, did you exercise, heavily exercise? So example of an heavily exercise is like running. Before collecting the blood, did he run? Yan. Because your strenuous exercise class or going to the gym, because your strenuous exercise can actually increase your class, acute phase reactants. We need to be careful with that one. Why? It can actually cause a false positive result. Okay? So as medical technologies or medical laboratory scientists in the future, we should, focus not only with the analytical phase but also with the pre-analytical phase of our laboratory, which is asking the patient uh, carefully if kung eligible ba siya to have this test or not. Yun. Diba? Very interesting yung future job natin, class. Okay, so let's move to the first acute phase reactants that we'll discuss, and that is your C-reactive protein class or your CRP. Okay, your CRP are trace constituents of your serum synthesized in the liver. So, sir, anong ibig sabihin ng trace constituents? Ibig sabihin in class, you have a normal value of C-reactive protein in the blood. So, it's not zero. Okay, so that's the reason why in your laboratory result, it should have a normal range. If, for example, in the normal range, it is above, then it is considered inflammation. Okay, take note with that one. And then discovered by Telet and Francis on 1930. They are originally defined by its calcium dependent. Later, I will explain that one class. And precipitation with the C polysaccharide of your pneumococcus. This is the reason why, class. If you will try to ask, so anong ibig sabihin ng C sa C-reactive protein? Okay, the C in the C-reactive protein class is the carbohydrate. Okay, the carbohydrate antigen of your Streptococcus pneumoniae class. Okay, your Streptococcus pneumoniae. In your bacteriology, diba, you can recall with Rebecca Lansfield classification, you have your group A, group B, group C, group D, group E. Yeah, diba? For example, you have your group A, Streptococci. They have your Streptococcus pyogenes. Class, Streptococcus agalactiae. Group B, Streptococci. Class. Group A is your Streptococcus pyogenes. Group B is your Streptococcus agalactiae. Yan. Okay? So, tapos si Streptococcus pneumoniae kasi wala siyang Lansfield classification, they have a specific carbohydrate, that's the C carbohydrate, and then your C-reactive protein will react with that one. That's the reason why this protein is reactive to the C antigen or carbohydrate antigen of your Streptococcus pneumoniae. Kaya sila tinawag na class? C-reactive protein. Yan. Okay? So, ito yung itsura niya, class, ng C-reactive protein mo. Okay? They are pentameric, 1, 2, 3, 4, and 5. And actually, class, they are a primitive form of antibody. Anong ibig sabihin ng primitive form? So, ang ibig sabihin daw ng class, ito yung ancestry of your antibodies. And later, I will show you what are the similarities of your C-reactive protein to your antibodies. So, your C-reactive protein is, again, ayan, we mentioned that one already, class. And then this one, you have your capsular polysaccharide of your Streptococcus pneumoniae. Yan, kaya siya tinawag na C-reactive protein, class. Okay? So, if you can observe here, class, your C-reactive protein here will bind to the phosphocoline, okay, or phosphocoline. So, your phosphocoline is part of your bacteria class. Here, ito yung bacteria mo. And then, your C-reactive protein have almost the same function of your antibodies. It will opsonize. And also, class, did you know that your C-reactive protein, aside from your antibody, can activate your classical pathway? So, here, class, your C-reactive protein will bind to your phosphocoline. It's up to you kung paano nyo siya i-pronounce. And then, your complement activation will be activated. Then, you have your C1. Ito yung C1 kasi, class. C1, tapos C2, tapos C1Q. C1Q, ito yung Q, class, yung green, for example, yung blue ang R. Then, ito yung S. Kaya meron tayong C1QRS complex. Tapos your C1QRS complex, class, is an enzyme that will degrade your C4. Ayan, do a separate discussion na to sa class with a complement, pero at least may idea lang kayo. Tapos, si C1QRS class here, si C1QRS is an enzyme that will degrade your C4, then your C4 will be divided into two. You have your C4A and you have your C4B. Your C4B will bind to the surface of your bacteria. Your C4A, they are called anaphylotoxin. Ibig sabihin, class, ano sila? They will try to call other phagocytic cells, like for example, neutrophil. And then, after the C4 class, the next protein, complement protein that will be degraded is your C2. And then you have your C2, ikakat niya class, you have your C2A and C2B. Pagdating naman ni C2 class, your C2 will have, so your C2A, C4B2A will bind to your C4B. Kaya nagkakaroon tayo ng C4B2A complex. Ang tawag naman natin dyan, class, is your C3 convertase. Hanggang dyan lang muna tayo, class. Tapos yung end product is your cell lysis. Para alam nyo lang. Kasi pag i-discuss ko to, I don't have any discussion point already with your complement activation. And we have that one on a separate video lecture. So please watch that up. Okay? So, again, with the purpose of this slide is that I want to show that your C-reactive protein can actually activate the complement cascade, specifically your classical pathway. Okay, the outstanding characteristic of your C-reactive protein class, okay, it appears in sera of individuals in response to a variety of inflammation, okay, inflammatory conditions. Then they are dramatically increased in concentration, of course, pag meron tayong inflammation. And then they will disappear when inflammation subsides. Okay, that's the reason why your C-reactive protein is a good indicator of your it's a good indicator of your inflammation. I had the COVID infection before, and then before I took my vaccination class. That's the reason why that time when I was admitted, one of the inflammation markers that they use is the C-reactive protein. And then my C-reactive protein that time is too high. For example, the normal range is around, I'm not very sure because I'm not familiar now. For example, 0.9 to 1 or 1.2, that's the normal range. And then my result with the C-reactive protein class that time is 23, 24, and then 26. And so it's too high. So it means that I have an active inflammation. My body, okay, is recognizing the virus, which is the SARS-CoV-2. And then the macrophage were able to catch that up and then produce the interleukin-1, then TNF, and then interleukin-6, telling the liver to produce the CRP or C-reactive protein. Okay? Ayun, diba? So I was able to correlate it with my personal experience, class. So appears rapidly after the onset of disease, may increase 1,000 times its normal amount. The fastest responding and most sensitive indicator of inflammation. In the laboratory class, if you will work as a medical technologist, this is the most common request in the serology section. If you're a physician and then you want to identify if there is an active inflammation aside from identifying if kung merong active inflammation class, your CRP is also a good marker for recovery. So for example, there is an active inflammation. Then you give the patient a drug. If you're a physician, of course, you give a drug to the patient. And then you want to monitor if the drug is working or not. And then what you will do? You need to measure the C-reactive protein. If the C-reactive protein is decreasing, it means that, okay, this drug is effective. So aside from identifying as a marker of inflammation, your C-reactive protein is also a good indicator for recovery. Sige, take note with that one. Okay, so it increases faster than your ESR. Your ESR is not that specific. Actually, Even with other countries like here in Japan class, we don't use ESR anymore. Kaya unless with small laboratories. Kaya with the Philippines, I have still experience with the ESR. Kaya more on screening lang talaga siya. Okay? CRP naman class is not very expensive in the Philippines. But compared with the ESR, meron siyang difference. Kaya majority of the physician usually check it first with the ESR and then with the C-reactive protein. Okay? So leukocyte count may remain within normal limits class despite the infection. That's the reason why you need to have a good, more sensitive marker, which is your C-reactive protein. For the properties, of course, you have your molecular weight, okay, around 118 to 120 Daltons in each, okay, class each. And then, kasi pentameric siya class. Then for the sedimentation rate, it's 6.5. And then for the electrophoretic mobility, take note, diba, as I mentioned earlier, that your antibodies, your C-reactive protein are primitive, okay, form of your antibodies. Then therefore, they migrate in the same region, which is your correct gamma, okay, region. Okay, if you can observe here on the antibodies, okay, on the gamma region. So they're composed of 5 identical subunits class, approximately 500 Daltons, okay, each linked in a form of your cyclic pentamer. Okay, so if you can observe here, okay, you have your 1, then you have your 2, then you have your 3, then 4, and then you have your 5. Okay, so pentameric sila compared with your antibodies. This is your antibodies. Okay, this is your Fab region, this is your FC region. Okay, this is your Hinds region class. Okay, and then I will discuss the basic parts of your antibodies pagdating natin sa discussion ng ating antigen antibodies. Okay, 100% protein, okay, with amino acid similar to immunoglobulins. That's the reason why, class, the other reference, our main reference book and other reference books class, they mentioned that your C-reactive protein is a primitive form of your antibodies. And then they have almost the same class, almost the same function. Okay, it can actually precipitate antigen, do agglutination, have opsonization or tagging, do also have your capsular swelling, and complement activation. So ang tanong, sir, so what's the difference of the two aside from the structure? Kasi alam naman natin that the structure of the CRP is pentameric. Then this one is a Y-shape with your antibodies. So aside from the structure, sir, are there any differences with the two? Yes. One class is the activation because your CRP requires calcium. The antibody does not. Okay, that's a good differentiation with the two. For the physical properties, you have your thermolabel. Okay, ibig sabihin, class, they usually destroyed at 70 degrees Celsius for 30 minutes and does not cross the placenta. Your antibodies can, but not all. Yeah, we'll discuss the different types of your antibodies that can cross the placenta. And then elevation of your CRP above normal indicates tissue damage and or inflammation. Okay? So current and potential use of your CRP, because your active protein, okay, the first to increase in the presence of your active inflammation around 4 to 6 hours during the inflammation, it will be increased. So imagine, class, within 4 hours to 6 hours, your interleukin 6 will increase already, or interleukin 1. Okay, telling your liver to produce your CRP within this hours. The peak level is 48 hours. Okay, the normal for male is 1.5. 1.5 pala, class, yung normal. For female, it's 2.5. The half-life is 19 hours. Sir, I'm not familiar with the term half-life. What does it mean? Half-life, class, it means that kung hanggang saan lang siya. Diba? So hanggang 19 hours lang siya, class. Then it will produce again. Okay? Half of the life is 19 hours. Sorry, class. Okay? and then decrease after the post-operative and day recovery period, ayan, as I mentioned earlier, and then can be used to correlate with ESR, WBC count, and your serum protein electrophoresis. Then, let's move to the second acute phase reactant, which is your serum amyloid A. Okay, class, we are done. Among all the C-reactive protein, among all the acute phase reactants, class, your C-reactive protein is the most common. That's the reason why almost half of our discussion in the APRs are focused more on the CRP. Okay, so now let's move to the second acute phase reactants. Then you have your serum amyloid A. Okay, it's still synthesized in the liver class. Okay, if you have here, so you have your inflammation infection, and then you have your interleukin 6, interleukin 1, and then after your liver, then it will release your SAA. Okay, your serum amyloid A. In the clinical laboratories, we call this one class SAA, okay, or serum amyloid A. Okay, molecular weight is around 11,685 daltons. Then normal circulating levels are approximately 30 microgram per ml, and they are associated with your HDL cholesterol. The association of the serum amyloid A to your HDL, I'll leave that one to your clinical chemistry. So the function of your serum amyloid A, okay, I will try to discuss slightly the correlation of the two. So it helps in removing your cholesterol from your cholesterol-filled macrophages and tissue injury, and then involved in the cleaning up of the injured areas, and then facilitates recycling of your cell membrane cholesterol and phospholipids for reuse in building membranes of your new cells required during your acute inflammation. Diba? So your serum amyloid A can actually help on the third stage, last stage of your inflammation, which is the recovery and repair. Okay, so take note with the function of your serum amyloid A. So it facilitates and help the reconstruction of the damaged tissue by collecting your cholesterol from a cholesterol-filled macrophages. Next, we'll proceed to your alpha-1 antitrypsin. Ito yung pinakamahirap na tanong, class. Your alpha-1 antitrypsin is located in what region? Yan, nag-isip pa tayo, class. You have your alpha-1. Okay? Diba ganito yung ano natin, class? You have albumin, alpha-1, alpha-2, beta, and then you have your gamma. Your alpha-1 antitrypsin is located here. Okay? So, it inhibits your leukocyte proteases. Okay? And then comprise 90% of your alpha-1 globulin band and prevent proteases from initiating tissue damage. This is the class, the main problem of your immune system, because the immune cells usually overreact. So by that, if for example, you will recruit your immune cells will also, specifically your leukocyte, will also produce proteases. Okay, and these proteases will try to destroy also your tissue. And then if, for example, the tissue is then still damaged, so what will happen? Your acute phase reactants will still continue to increase. That's the reason why you have your alpha-1 antitrypsin, because this one will try to inhibit your will inhibit your leukocyte proteases. Okay, so if you have a deficiency of this one with alpha-1 antitrypsin, then you will have emphysematous pulmonary disease, at saka you have your juvenile hepatic disorders. Your alpha-1 antitrypsin also in your bacteriology, it discussed specifically in your Pseudomonas aeruginosa that is linked to your cystic fibrosis. So hopefully that in your bacteriology, yeah, the alpha-1 antitrypsin is also introduced, so you can correlate. And or if it's not, so for example, in your Pseudomonas aeruginosa, then they will try to correlate that one with your cystic fibrosis. Maybe you can ask, how does the organism Pseudomonas aeruginosa affects the produce the disease cystic fibrosis, and then it lies on the alpha-1 antitrypsin. Okay, so it's a good question to your bacteriology professor class. Then next, we'll move to your haptoglobin. Okay, the molecular weight of your haptoglobin is around 100,000 Daltons. Then they are located on the alpha 2. Okay, you have your alpha 1, then you have your alpha 2. Okay, you have your haptoglobin. Okay, aside from the haptoglobin class, we'll also introduce to you your seroluplasmin. Okay, so later we will introduce the seroluplasmin. Uh, Your haptoglobin are reversibly bind to the free hemoglobin. Ayun, this is a good term, irreversibly. Ibig sabihin, class, when they bind, hindi na sila natatanggal. Okay, they increase 2 to 4-fold during inflammation. And then, ayun, found in inflammation process. Okay, so irreversibly bind, okay, to free hemoglobin. Like, for example, you have your hemolytic, hemolytic anemia, or any other active inflammation that deals with the disruption of your red blood cell that will release your hemoglobin, then you have your haptoglobin. Okay, and then hopefully in your hematology you will also discuss more on the function of your haptoglobin in your hemolytic anemia. But in our course, immunology, I just wanted to tell you that your haptoglobin is part of our acute phase reactants that will try to remove and bind to your free hemoglobin. So this is the expected increase of your SPE, okay, on your alpha 2. Okay, so this is the normal, then this is the increase alpha 2 bond, possibly with the increased haptoglobin. So your haptoglobin plays an important role in the protection or protecting the kidney from your damage and preventing the loss of iron by urinary extraction. Okay, so that's one, alpha 1 antitrypsin, and then you have your haptoglobin. So it provides protection against oxidative damage mediated by free hemoglobin, as I mentioned earlier. Kasi very toxic yung free hemoglobin, so dapat may kumuha sa kanya, and that's your haptoglobin. Kaya powerful oxidizing agent that can generate your peroxidases and hydroxyl radicals. Okay, I believe that your haptoglobin, specifically on this function class, will be explained in detail pagdating sa hematology, hopefully. Okay, so for the immunology, again, it's more on the part of your acute phase reactants. And then you have your fibrinogen, okay, accumulates at site of injury, and then convert your fibrin, okay, converted to fibrin class, sorry, converted to fibrin. And your fibrin is a mesh class, okay, Hassan's wound healing process. And then stimulate your fibroblast proliferation and diba? I believe that you're familiar with fibrinogen because this is also associated with the laboratory diagnosis of your Staphylococcus aureus because they have your coagulase. Okay, your coagulase will also destroy, or sorry, class will try to degrade your fibrinogen, okay, and use up the fibrin to coat. Okay, di ba ganun katalino yung mga Staphylococcus aureus class. Okay? But fibrinogen is a negative phase reactant together with your albumin class. And you have your ceruloplasmin. Okay, your ceruloplasmin is well discussed in your clinical chemistry, but in the sense of your immunology, we will discuss this one as an acute phase reactant. Okay, the liver normally take copper, okay, from the bloodstream and puts into your ceruloplasmin protein. Okay, so the ceruloplasmin is then released into your blood plasma. So your ceruloplasmin carries your copper around your body to the tissue that need it. Yan. So pag may kulang ng copper, then your ceruloplasmin, kasi sila yung nagso-store ng your ceruloplasmin stores your copper, and then if for example during inflammation and then there's a need of your copper, then your ceruloplasmin will increase and then transport that one to a specific part of your tissue that requires it. And then you also have your alpha 2 macroglobulin under your ano class? Ayan, so we discussed already your heptoglobin, your ceruloplasmin, and now we'll discuss your alpha-2 macroglobulin. Okay? An inhibitor of your proteases involved in inflammatory reactions. They almost the same with your alpha-1 antitrypsin. Okay? So either your acute phase reactants will also regulate the overreaction of your cells, okay, your immune cells. Kasi hindi naman din alam ng immune cells. We cannot, blame the immune cells. They just want to, show up that they're capable with this power class. Kaya they usually release proteases without thinking na these proteases and then enzymes, for example, will destroy the tissue. Okay? So as a negative feedback, well, the immune system, they will try also to produce enzymes that will regulate this one. Diba? You have your alpha-1 antitrypsin, you have your alpha-2 macroglobulin. Imagine, class, okay, how your immune system is created delicately, okay, to balance that one, class. So we should be thankful because we have an active immune system, class. Okay. And then lastly, you have your complement. Okay, so your complement refers to a series of your serum protein that are normally present and whose overall function is mediated of the inflammation. Though we have a separate discussion with this one class kasi very important yung complement. But I usually mention it already, right? Like for example, you have your antibodies. For example, pag may antibodies ka, tapos yung antibodies mo, your complement proteins will be activated. Your C1QRS, tapos C4, C4B, tapos C2, C4, C2A, kaya meron tayong C4B2A, tapos tawag natin dyan class is C3 convertase that will cleave your C3, and then your C3B will bind to your C3 convertase, kaya nagkakaroon tayo ng C4B2A3B, tawag natin doon class is your C5 convertase. Then your C5 convertase, of course, an enzyme kasi may ESE siya sa last, will divide and or cleave your C5 to C5A to C5B. Your C5A will be acute anaphylotoxins. Then your C5B will bind again to your bacteria, and then will recruit your C6, 7, 8, and then 9, and then will make a hole, and then tada, cell lysis. Diba? Kasi yung alam lang natin class before in your human anatomy and your other subjects during high school is that may phagocytosis, may cell lysis, and then now, kasi more elevated part na tayo, then you will know the function of your complement. And then what's the activation pathway. Tapos, ano pa yan, class? Classical pathway pa yan. You have 3 pathway of your complement. You have your classical pathway, you have your alternative pathway, and then you have your lectin pathway or MBL, manus binding lectin pathway. So, it's somewhat interesting class. So, we'll discuss that one, hopefully. And that's it for the presentation of your acute phase reactants. I know this is somewhat lengthy because your inflammation is connected with your acute phase reactants. But at least, hopefully that you get something with the inflammation because we can now see in a molecular level class, and not in a molecular level, see in a cellular level with the inflammation. Kasi alam lang natin, okay, may siya, may may inflammation siya outside. Like for example, redness. Pero ngayon, we know the recruitment of the cells with the selectin ligands, you have your ICAM1, and then the production of interleukins, you have interleukin 1, interleukin 6, and alpha, liver, APRs, and then the different function of your APRs. Hopefully, I know it's somewhat heavy, but you grab something class, okay? And then if you have some questions and or clarifications, please don't hesitate to contact your professors and we'll try to clear the gray areas of your immunology and serology. And I think that's it. And then see you for the Innate Immunity Series Lecture number 2. Okay, thank you class for bearing with the lecture. I know it's somewhat heavy. Yun. So hopefully you get something. And bye-bye. Thank you. Thank you very much class for listening.